Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the COVID-19 pandemic update with data accurate through January 27th, 2022. This week, I'm going to address two questions that have been posed in the last week. Is the Omicron surge coming to an end? There appears to be a lot of news media suggesting that this is, in fact, the case. So let's look at the data. And the second, increasingly, people are saying, what do I do if I've been exposed or if I test positive? This is becoming increasingly common because of the high rate of infectivity of the Omicron variant. So is the Omicron surge coming to an end? Well, globally, you can see we've just had this incredible increase in the number of cases, and it doesn't appear as if it's coming down just yet. It does look like it's leveling off, but not coming down. In terms of deaths, we're continuing to see an increase in the number of deaths. So globally, it doesn't appear as if the Omicron surge, if you will, is coming to an end. And in fact, the number of deaths, the daily number of deaths, is about the fourth highest peak that we've had in the pandemic. Over 5.5 million total deaths to date and 8,500 deaths every day. In terms of the United States, we are seeing a decrease in the daily number of cases, though it is still extremely high and much higher than it's been at any other time in the pandemic other than this current surge. We're also seeing a decrease in hospitalizations for virtually every age group. That's a promising sign. But unfortunately, we're still seeing an increase in the number of deaths. And that's perhaps not too surprising because we've had so many cases, so many hospitalizations, and we know that deaths follow hospitalizations by a couple of weeks. Hospitalizations follow cases by a couple of weeks. And again, we're at now the second highest number of daily deaths that we've had during this pandemic in terms of peaks. Almost 900,000 total deaths from COVID-19 in the United States to date, and about 2,200 deaths every day. If you look at the map of where cases have been in the past few weeks, you can see this gradual spread around the country. And now those places with the very darkest splotches, including Tennessee, Kentucky, Southwest Virginia, you really can sort of see a group in central Appalachia as well. In terms of Tennessee, we're continuing to see this spike in cases. Perhaps it's leveling off or coming down. It's a little bit too early to say. In terms of hospitalizations, we are not seeing it decrease yet. Still seeing it increase, especially in the highest risk groups. And then in terms of deaths, there seems to be this gradual but erratic climb in the total number of deaths. Overall, over 22,000 people in Tennessee have died from COVID, and we're losing about 60 every day. In terms of the Ballot Health Service Area, Ballot is now reporting the highest number of COVID hospitalizations in history. 86% are not fully vaccinated of the hospitalized patients. 95% of those in the intensive care unit are not fully vaccinated, and 96% of those who are intubated. Last week, I think it was, we started looking a little bit more at the relationship between number of people hospitalized in ICU and intubations. And so there you see hospitalizations in red, ICU admissions in black, and then intubated patients in yellow. And what you can see is a widening gap between the two. And so over the most of the last 5 months, the percent of hospitalized patients that were in the ICU ranged between 24 and 28%. Last week, it dropped pretty quickly, and again this week. So why are we seeing a increased number of hospitalizations, but a relatively lower number of folks in the ICU? Well, one reason is vaccinated folks are less likely to have severe disease. Another is that Omicron probably is less serious than previous variants. That may be because of better treatment options, and it may be because there are more incidental infections. That is, folks who are admitted to the hospital for one cause who were found to have COVID-19. However, despite all of that, If you look at this again, you realize that since November, the number of patients in the ICU have gone up by 50%, as have the number of patients who are intubated. So while relatively Omicron doesn't appear to be as serious as the Delta and the Alpha variant, in terms of its total volume, it's having a huge impact just because of how many people are affected by it. So we're not out of the woods yet, for sure. So in answer to the question, is the Omicron surge coming to an end? What folks really want to ask is the pandemic coming to an end? If we go back into this map of this chart of global daily deaths, there's two ways to interpret this, right? The first is that each peak seems to be coming down, and that maybe over the next month or two, we'll see it then coming closer and closer to zero. There's another way to look at this, and that is that this virus keeps jumping up and down, up and down, up and down, and it may be going back up again. We simply don't know. So I think over the next couple of weeks, we'll have a better sense of what the pandemic overall is doing. I do think it looks like, at least nationally, the Omicron surge is coming back down, but still number of cases and number of deaths are exceptionally high. Because of how infectious Omicron is, I'm getting more people asking me what they should do if they're exposed or if they test positive. So there's a partial answer that you can get from the Centers for Disease Control and Prevention. If you search CDC Isolation Guidelines, it will take you to this page. If you scroll down the left-hand side, you'll see a series of things that say, if you were exposed and are not up to date, it tells you how you should quarantine, when you should get tested, when you can end quarantine, what precautions you should take. You scroll farther down the page, what if you were exposed, but you are up to date? It says you don't need to quarantine unless you develop symptoms and so on all the way across. And you need to read each of these and read it all the way across. And then the third category is if you've had COVID in the last 90 days. If you scroll further down, it says what you should do if you test positive, regardless of your vaccination status. It tells you how many days you should stay home, where you wear a mask, and so on. There's a lot more information on this page. What do you do for quarantine? How do you deal with congregate settings like nursing homes? When do you end isolation if you didn't have symptoms, if you had severe symptoms, and so on and so forth? But I said that's only a partial answer because it only gives you general guidelines. There's a couple of things that each of us has to take into account. And the first is, what's your risk tolerance? Some people drive motorcycles, some people climb cliffs, others want to be as safe as possible. The CDC guidelines are general guidelines for general public, but you may wish to be more cautious than they're suggesting. The second reason it's only a partial answer is it doesn't take into account whether you or a family member or close contact is in a high-risk group for complications, right? These are the categories: over 65, immune suppressed, diabetes, chronic kidney, heart, pulmonary, neurologic, liver, or pregnant and recently pregnant. If you're in one of those categories, you should err on the side of being much more cautious. And then, of course, if you or your family member or close contact work in a profession where your inability to work could cause significant societal harm, if you're a frontline healthcare worker, for example, you're getting sick with COVID and having to quarantine or isolate is a significant burden to society, and you need to be more cautious. And also for those of you who work in congregate settings, especially nursing homes with a lot of elderly folks with chronic disease. So again, in all of those cases, you have to take that into account. So this website is helpful. It gives you some guidance, but if you're in doubt, ask your healthcare provider. So is the Omicron surge coming to an end? Maybe, at least in the United States. And what should you do if you've been exposed, or if you test positive? Well, if you don't have symptoms, go to the CDC website. If you do have symptoms, talk to your healthcare provider. There's a great deal more information about COVID-19 on the College of Public Health website. If you are sharing this video with anyone, please let us know. We'd be happy to add them to our listserv. As always, I'd like to thank Dara Young for editing, producing, and posting this video. And as you can tell, I base these videos now largely on the questions that I get from you. So please feel free to send me an email. Let me know what questions you have about what I've said today or about COVID more generally. Until next week, please be well. Thank you.